All right, two well-known names from the sports world sharing their health battles this week, bringing attention to serious medical conditions that people may not know much about.
Yeah, Dallas Cowboys owner Jerry Jones has revealed that he has successfully fought stage 4 melanoma for a decade using experimental treatments, while tennis legend Monica Seles has disclosed her diagnosis with myasthenia gravis.
And here to help us understand these conditions and what people should know about the symptoms and the treatments is Dr. Stephanie Widmer. Thank you so much for joining us this morning. She is the director of medical toxicology service at St. John's Riverside Hospital. Now, Jerry Jones says he had stage 4 melanoma for a decade. Help us understand, what does stage 4 melanoma mean and how serious is this diagnosis?
Sure. So historically, stage 4 cancer in general sounds very scary, right? And historically, stage 4 melanoma carried a very grim prognosis. What stage 4 means is that it's the most advanced type of melanoma, and it has essentially spread to other organs. It's spread from the skin to the lung, brain, liver, and, you know, despite the fact that historically it's had such a poor prognosis, some of these medications that are now available are kind of changing that outlook.
Well, let's talk about that, because Jones credits something called PD-1 therapy for saving his life. A couple questions here. What is that treatment? How does it work? And is this accessible to just anyone out there, or is it, you know, really expensive?
You have to own a football team to
exactly.
afford it.
So PD-1 inhibitors, or PD-1 drugs, these are checkpoint inhibitors or immunotherapy drugs. And the way they work is they target this protein, this PD-1 protein, which kind of helps the cancer cells hide from our immune system. And it essentially exposes the cancer cells, allowing our immune system to do its job and kind of take out these cancer cells, hopefully. They're not necessarily available to everyone, depending upon what type of PD-1 inhibitor or what type of treatment we're looking at. Some are strictly involved in clinical trials, but PD-1 drugs are not necessarily new. They have been FDA approved for quite some time for the treatment of melanoma.
He actually says that he has no tumors after years of this treatment. So I'm wondering how common that is as an outcome for stage 4 melanoma patients.
Now, 10 to 15 years ago, this was something that was incredibly rare to see. Now, with these new drugs and with these clinical trials, the success rates and the survival rates are increasing. I can't stamp an exact number because clinical trials are still ongoing. We're still collecting data. But there really has been, and again, these drugs don't work for everyone, but for people that do benefit from these drugs, there really can be profound and really positive results, just like we've seen in this case.
Yeah.
And what skin changes should people be on the lookout for? I know I have a mole that I look at. It's like symmetry. That's one of the things you have to look at, right?
That's right. So an easy way to remember this is kind of the ABCs of melanoma, or it's really ABCDE. So asymmetry, if one side of the mole looks different from another side of the mole. B, the borders. So if the borders are irregular, jagged, or scalloped. C is the color, so if there's a lot of different colors in the mole or a very, very dark color. D is diameter, so greater than 6 millimeters, or if it's bigger than a pencil eraser. And then E is evolving, so if you've had a mole for a very, very long time and it looks like it's changing or it's very, very different, that's a really good reason to go see your dermatologist.
And get checked every year anyway.
Absolutely.
Should get checked out. Let's talk about Monica Seles. She said she was experiencing double vision and muscle weakness, and she was just recently diagnosed. Tell us what she was diagnosed with and what she'd be on the lookout for.
So she was diagnosed with a condition called Myasthenia Gravis. This is a neuromuscular condition, and it's a chronic autoimmune disease. So when you hear the word autoimmune, you think about the body attacking itself. And in this particular scenario, it's a disruption between communication between the muscle and the nerve. And what that looks like, or what that manifests as on the outside, can be weakness, really in the facial and neck muscles, or eyes and throat.
She said double vision is what she was experiencing.
Exactly. And sometimes
so
you
is
can
that
have
an ocular version that she has?
She may, but a lot of times it starts to affect larger muscles, and you can have exacerbations or flares that can really affect your breathing, and it can be quite scary.
It's treatable, or
so there's not really a cure for this, so to speak, but there are medications that you can use to treat symptoms. There are medications that we talked about immunotherapy, that can target an overactive immune system. And then there are more aggressive interventions that can be used during a flare.
I think the takeaway is these well-known people are talking about their situations and their medical diagnoses and how they're dealing with that,
awareness.
which brings awareness. And we appreciate you and your insights, Dr. Stephanie Widmer.
Much.
Thanks for joining
Thank
us
you.
today.